What is osteoarthritis? Osteoarthritis is defined as a degenerative joint disease when this condition affects articular cartilage that has been repeatedly pressured over time. This condition often occurs at the knee joint. What are the symptoms of knee osteoarthritis? Frequent complaints in knee osteoarthritis patients include pain, muscular weakness, joint instability, morning stiffness, crepitus, and functional impairments. So, what is the solution for this condition? Exercises are one of the conservative management that can be done to treat the symptoms of knee osteoarthritis and can improve physical function. We prescribe an exercise program of 3 times per week by combining 4 types of exercise, which are aerobic exercise, stretching exercise, strengthening exercise, and balance training within 12 weeks.
Firstly, we will start a 3 to 5 minutes of warm-up session before we start our exercise program. Prior to aerobic exercise, we need to calculate our heart rate reserve. First, we will start with moderate intensity, 40 to 50% of heart rate reserve. Then, we will progress to 60 to 70% of heart rate reserve. We will then use the calculated heart rate reserve of 40 to 50% for 20 minutes cycling, and then progress to 60 to 70% of heart rate reserve of 30 minutes cycling.
Next is stretching exercise. So first is heel cord stretch with low intensity, 2 sets of 3 repetitions and 30-second stretch. Make sure the affected leg is fully contact with the floor and feel the stretch at the calf area. Second is standing quadriceps stretching with low intensity, 2 sets of 3 repetitions and 30-second stretch. Perform this exercise near a wall or chair as a precaution and to prevent fall. Make sure the knee is fully flexed and feel the stretch on the front part of the hip or leg. Third is seated hamstring stretch with low intensity, 2 sets of 3 repetitions and 30-second stretch. This exercise requires a towel to stretch the affected leg. Make sure the knee is fully extended and feel the stretch at the back of the leg.
Next is resistance training. There are 3 phases of intensity. First is 20 to 40% of 1 repetition maximum in week 1 to 3. Then 40 to 60% in week 4 to week 7, and lastly 60 to 80% of 1 repetition maximum for the final week. The first resistance exercise is seated knee flexion and extension. Perform 3 sets of 10 repetitions. Make sure your knee is fully extended during the knee extension. Next is standing 4-plane SRR. This consists hip flexion, extension, abduction, and adduction. Perform 3 sets of 10 repetitions. Make sure to perform this exercise nearby a wall or a chair for safety purposes. Next, perform a mini squat by a wall, 3 sets of 10 repetitions. Make sure to squat not more than 45 degrees. Lastly, step up and down. Perform 3 sets of 10 repetitions of step up and down stairs. Finally, balance training. Start with static balance of moderate intensity. Perform 10 repetitions of 10 to 30 second hold with double support. Then progress with single leg stand with 1 hand support. And finally, progress to single leg stands with eyes closed. Lastly, dynamic balance. Perform side stepping exercise with 2 hand support, progress to 1 hand support, and finally with eyes closed. Remember to always perform with a chair, a partner to supervise for safety purposes. Lastly, don't forget to have a 3 to 5 minutes of cooling down session after completing all the exercises.